Contrary to its name, Rocky Mountain spotted fever is actually more of an East Coast, southeastern United States infection. Okay, got its name Rocky Mountain spotted fever because the initial patient that presented with it, first clinical patient, was in the Rockies. I forget where in Colorado, but it's actually, eastern Canada, eastern U.S., southeast, and they're starting to see it identify it down in South America. This is another tick-borne disease. So where the ticks are the most prevalent, that's where you're going to find this. When tick populations are high, well, turns out our infection rates are high. When tick populations are low, new cases are low. Rickettsia rickettsii is the bacterium. Okay, instead of just one tick, there are a couple of ticks. The wood tick, the Lone Star tick, the American dog tick can harbor this, act as the vector. It gets its name spotted fever because, well, literally, as you can see there on the right, you get this spotted rash. Two to 4 day incubation period after the bite. So it's pretty recent. Okay, it's not going, it's pretty, I'd consider this one acute / subacute. Okay, it's not a long chronic, not a long-term thing to set in. Going to start with the fever. Again, we're talking non-hemorrhagic fevers. Fever, chills, headache, muscle pain. Muscle pain is because of the overall body inflammation, the inflammatory response. Then you're going to start to develop this rash. Starts at the wrist, spreads up the forearms, starts at the ankles, spreads up the legs. So starts at the extremities and then may spread to the trunk. This is much different than if you think back to the skin chapter when we were talking those rashes that are primarily skin, where they start head to trunk, trunk to extremities. Here it's extremities to the trunk. Initially, this spotted rash resembles the measles. So first off, you may think patient that presents in your hospital, your clinic, maybe early symptoms of measles. But as the rash develops, the little lesions become much larger, and the way they spread will be different than the measles. Untreated, for some patients, these lesions will get larger and larger, and the capillary beds underneath will become damaged, irreparably damaged. Means blood flow into that area will be impeded. No blood flow on, no blood flow in, no blood flow out. Also means that the tissues there, the skin cells there, are going to start to die. You're going to start getting an ulcer, necrotic tissues. For some people who already have blood flow issues, diabetics and whatnot, can see the beginning onset of gangrene in the toes and the fingertips. Because remember, keep in mind, diabetics, especially type 2 diabetics, are going to have issues with blood flow to their fingers and toes to begin with. You start getting this rash due to the Rocky Mountain spotted fever, Borrelia rickettsia, impeding blood flow that's already impeded. Well, things will happen. Advanced cases, the rickettsia being in the blood is going to spread. It's going to lead to cardiovascular problems. Many patients are going to, have issues, restlessness, delirium, convulsions, coma. This is impeded blood flow through certain capillary beds, the head to toe inflammatory response leading to shock. Untreated, 20% mortality rate. Treated, this drops to 5-10%. So it's still, even treated, has a high mortality rate, a little too high, for now, but we are trying to develop more treatments where there's not much we can do about rickettsia when it's in, but we can develop better supportive treatment mechanisms so that, when there's a cardiovascular issue, how do we sit there and, keep everything going as we try to clear out and repair damage. When a patient progresses to the point where they're having convulsions and coma, how do we minimize, brain damage so that way that they have a chance to recover?